Good afternoon. I'm Commander Anna Kahn, Associate Director for Communication with the Division of Environmental Health Science and Practice in the National Center for Environmental Health at the Centers for Disease Control and Prevention. I'd like to welcome you to today's Nexus partner webinar on Heat and Health Initiative. There will be a presentation and a Q&A session with panelists. All participants joining us today are in listen-only mode. Closed captions are available for this webinar. Today's Nexus webinar will be available to view in a few days after this webinar. You can find the video recording of today's webinar on the CDC Nexus webpage, or you can scan the QR code. Next slide, please. You may submit questions at any time during today's presentation. To ask a question using Zoom, click on the Q&A button at the bottom of your screen, then type your question in the Q&A box. Please note that we often get more questions than we can answer during a live session. Next slide, please. The findings and conclusions of this presentation are those of the authors and do not necessarily represent the office position of the CDC. Next slide, please. And now I'm pleased to have with us today 5 presenters for the Nexus webinar. Our first presenter is Dr. Ari Bernstein, the Director of the National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry. He will provide some opening remarks sharing why and how this Heat and Health initiative came to be. Our second presenter is Director Ken Graham, the Director of the National Weather Service at the National Oceanic and Atmospheric Administration. He will provide additional opening remarks on the development and implementation of the HeatRisk forecast tool. Our third presenter is Dr. Rish Vaidyanathan, Senior Health Scientist with the Climate and Health Program at the National Center for Environmental Health. He will provide an overview of resources available through the Heat and Health Initiative. Our fourth presenter is Ms. Holly Wilson, the Health Communication Specialist with the Environmental Public Health Tracking Program at the National Center for Environmental Health. She will provide a live demonstration of the newly launched CDC consumer-friendly heat risk dashboard that equips the public with the information that they need to know better to protect themselves when outdoor temperatures may be higher than normal or could impact their health. Our fifth and final presenter is Dr. Laura Seif, Senior Medical Advisor with the National Center for Environmental Health. She will present on the newly released clinical guidance to help healthcare professionals guide patients who may be at higher risk for heat-related illnesses. Now I'd like to turn it over to our first presenter, Dr. Ari Bernstein. Dr. Bernstein, the floor is yours.
Thanks so much, Anna, and welcome everyone. Delighted to be with you to talk about the work we've been doing around heat. One of the main challenges I have seen in working on issues related to heat and health for a long time is knowing how hot is too hot for health where we live. And even if you do know how hot is too hot, what are the steps that can be taken to make sure that an individual stays safe? What we'll be talking about today are new tools and resources that will help us both know how hot is too hot for health and the actions needed. For many of you, it's obvious why we at CDC need to lean in on heat. We know that last summer, 120,000 people showed up at emergency departments from heat-related illnesses alone. And each year, heat exacts a hefty toll on death, especially in comparison to other disasters. And I personally am so delighted that the work you will be hearing about during the session reflects a terrific collaboration that has really taken shape over many, many years with the National Weather Service. Delighted that Ken Graham will be speaking just after me to talk more about the HeatRisk tool. And a bit later, you will hear more from folks at CDC, both about how HeatRisk is tied to health outcomes data, and also the guidance that we have developed from Laura Seif, and how all of this is packaged into a publicly facing dashboard, as Anna mentioned, available at cdc.gov/HeatRisk. So with that, thank you all for being here, and I will turn it over to Director Graham for his opening remarks.
Yeah, thank you, Ari. This is an incredible opportunity that we have here. I mean, if you think about the historic nature, we just did an incredible news conference on this very HeatRisk tool, and we're really proud of it. Not just a HeatRisk tool, but we're really proud of the partnership with CDC, and just really an amazing opportunity that we have to get information out about heat. As Ari mentioned, you think about the number of people impacted by heat from emergency rooms, the number one killer, basically. We think of weather phenomenon and how hurricanes can impact people. You see the damage, you see the impacts of tornadoes and floods and the fatalities there. But what people don't realize is the heat is the number one killer, more than hurricanes, floods, and tornadoes combined. So this is a very serious topic, and that's why this is such an important tool. It's the number one killer. And last year, Maricopa County, Arizona, where actually I'm from, there were 645 heat-related fatalities, and that's just one county's report out of over 3,000 counties across this country. In 2021, an analysis by the New York Times suggested around 600 excess deaths occurred in late June to July across the states of Oregon and Washington. So it's a very serious topic. Here at the Weather Service, we've got heat index, we've got wet bulb globe temperature, we've got some of these tools, but HeatRisk is special. HeatRisk, takes into account the meteorology, takes into account the science. It's able to look at all that and then combine what we have associated with the meteorology with the information at the CDC. Looking at the CDC's information and being able to combine that with what typically could happen in an area. It's different in Phoenix than it is in Seattle. It's different than Minneapolis versus Miami. So it takes into account some of that medical data, the other data in top of the meteorology, and that's what puts together the HeatRisk. That's why this is so incredibly exciting, because it actually takes some of those impacts into account as well. The HeatRisk came out of the need for decision makers to understand the complexities of the forecasted heat and the potential impacts across any geographic area, different climate regimes. In 2013, the HeatRisk prototype was developed by the Weather Service after the California Office of Emergency Services approached the Weather Service Western Region headquarters with the need. They came forward and said, we need to do something different here. And that partnership there with California and the National Weather Service was the initial prototype, was based on this long-term climatology. In 2018, did some more. 2018, HeatRisk developers said, you know what, we need to work with the CDC and incorporate heat health data into that, and to really look at heat risk category thresholds. And that's the version of the HeatRisk that you see today, released in 2022. And today, today and really you look at, this week is really the way to look at it. So this week we're expanding the HeatRisk from California to Florida and Washington to Maine. In other words, we're expanding this coast to coast. And this is what it looks like right here. Absolutely incredible to be able to look at it. And I was looking at the chat. In the chat, you'll see the link, www.wpc.nsep.noaa.gov/HeatRisk. And we're going to be looking at, being able to go there, go look at it every day. And we're going to try to really see that, how it progresses. And it's experimental. We're going to learn a lot as we really look at this and see how it influences our heat advisories and our heat warnings going forward. So HeatRisk takes into account that local forecast temperature, looks at climatology, what should it really be this time of year, and looks at health data and it gives you a simple color numeric system out to 7 days. Real quick, you can see the trouble spots. Looking at the map here, you can see some of the orange areas, some of the trouble spots there in Texas, where you can actually zoom in and be able to see that. The color numeric based information index, really high resolution climate data goes into this, the CDC mortality information, and in the end, over a 24-hour period for up to 7 days, you can see that threat for each day out to 7 days. It takes into account how unusually the temperature is for that time of year, the duration of the heat, both daytime and nighttime. Remember, impacts occur quite frequently when you don't have the nighttime to recover. So that is also in here. And if the temperatures are at high enough levels to pose an elevated risk for health complications based on CDC data, and that'll also influence the colors. So it's easy to understand, it's simple. You can see the colors there from that yellow, orange, red, and magenta. Easy to understand information here, and it's available for the next week. You can also zoom in and get that information for each area and see when you might have to make decisions that we may not want to do the construction today. We may not want to do that outdoor activity today. We may want to wait a few days or do it early before the big heat comes in. So you can look at the heat risk from Bangor, Maine to Phoenix for today and Saturday and understand these categories, and that's what makes it exciting. So I'm going to wrap it up with this. I just want to thank this partnership. This is true government coming together to be able to do something incredible to save lives. So I just appreciate the CDC, the Weather Service partnership. Absolutely amazing. This is the direction that the Weather Service is going as we transform this agency to really meet face to face with our partners, and decision making will be a big part of that. And we've got a whole KENS 10 initiative, and we're actually bending our entire agency's future based on doing more of these type of things to help decision makers make those tough decisions. So I appreciate everybody doing this, and I'll turn it back over. But you can tell I'm excited. What an incredible thing that we have here. And anyway, I just appreciate the partnership, and thank you everybody so much.
Thank you so much, Dr. Bernstein and Director Graham, for opening remarks. I'd like to hand it over to our next presenter, Dr. Rish Vaidyanathan, for his presentation. Rish, the floor is yours.
Sure. Thank you, Anna. First, we really appreciate this collaboration with the National Weather Service. It's a fantastic data-driven collaboration. And we're also grateful to the support provided by National Weather Service colleagues during the development of the CDC's HeatRisk dashboard. As you heard from Dr. Bernstein, CDC's HeatRisk dashboard is designed for the public and complements information presented on the National Weather Service website that Director Graham just shared. And on the dashboard, which is hosted by CDC's Environmental Public Health Tracking Network, we integrate various heat resources in an intuitive and easy to use interface. And the dashboard can also be viewed on a mobile device. And the dashboard, provides information on heat risk with a 7-day outlook, very similar to what's available on the National Weather Service website. The dashboard also provides information on air quality using air quality index information from EPA's AirNav. In addition to presenting data, this dashboard also recommends health actions based on both heat risk categories and AQI levels. And lastly, the dashboard is also the landing page for clinical guidance and other public-facing documents that were released by CDC this week. And you will hear more on those from Dr. Laura Seif. The information is searchable by zip code. And if you're interested in downloading heat risk or other heat-related data sets, you can do so by visiting CDC's Tracking Data Explorer. And now over to Holly for a live demo of the heat risk dashboard. Over to you, Holly.
Holly, you're on mute.
My apologies. Thank you so much. I've got my screen pulled up here. I'm really excited to share with you the heat risk dashboard. As others have said, this has come out from some really strong working relationships across government. And we're really proud to have it out and have a useful tool that people can use to make some good health decisions when the weather is getting a little hotter. So this is the landing page for the dashboard. It's at www.cdc.gov/heatrisk. And once you pull this up, you'll see a couple of things. First, you'll see that you're prompted to enter your zip code. We'll get right back to that, but I wanted to point out some other things first. Down here is a national map. It's pulling the data from the heat risk tool that National Weather Service showed earlier. You can, this map is fully interactive. You can hover over it and see a county name with today's heat risk. Rish mentioned that you can access these heat risk data and other heat related data from the Data Explorer. And there's a link to that right over here. And we also link back to the National Weather Service heat risk tool from here as well. We also have some information Rish mentioned for people to get extra information about heat and their health. And we have links back to the clinical guidelines that are meant for our healthcare professionals. And you can also find out more information and details about the data sets that are used in this dashboard. So let's jump in to see how this thing works. So I thought we would see what's going on in DeKalb County today. This is where our National Center for Environmental Health is located. And once you enter your zip code, you will see that the information changes a bit on the page. So today's heat risk in DeKalb County, Georgia, is little to none. And the heat risk dial on the left there is pointing little to none. And to the right, you get a little more contextual information about the day and what the risk might mean for certain groups. If this were a hotter day or the risk were elevated into yellow, orange, red, or the purple level, then there would be additional health guidance that would be included right below here with suggestions that people can take to have a safe and healthy time outdoors. The heat risk forecast is also included, so you can see a few days ahead about where the weather might be heading. Here in DeKalb, it's going to be a little bit more elevated risk for the remainder of the next week or so. If you keep scrolling down, you'll see that national map again, links to the informational web pages that have the clinical guidelines and general information about heat and health. And if you keep scrolling, you'll see the air quality index for today. As Rish mentioned, this is pulled from EPA's Air Now, air quality index tool that a lot of people are used to seeing on their phones or in weather apps, or from EPA's website. This also gives more contextual information about the air quality and the possible health risks for that day with actions that you can take to protect your health. At the bottom of all of the pages in the dashboard, we do acknowledge all of the partners that had a hand in developing the heat risk tool and the heat risk dashboard. So if we scroll back up to the top here, I just wanted to mention one more item. For the first time, CDC has included this geolocation button in one of our products. If you are using your phone, maybe you're in an area where you might not know the zip code, you can press the geolocation tool and your area will populate for you within the tool. And that is a big overview of the heat risk dashboard. Thank you.
Thank you, Holly. Now I'd like to introduce our next speaker, Dr. Laura Seif. Dr. Seif, the floor is yours.
Thank you, Anna, and good afternoon, everybody. We are so pleased to be sharing highlights of today's just released yesterday or Monday heat and health guidance, resources that we hope will be useful to each of you in your own professional settings. And we thank so many of you on the line who lent your expertise in the development of these guidelines. So why did we go down this path? You've heard from my esteemed, you know this already, and you've heard from my esteemed colleagues on the phone. It is hot and getting hotter. Last summer was the hottest summer in record in the nation since we started measuring temperatures in the 1880s. We're anticipating an extremely hot summer this summer. You've heard this and you know this already. More people die from heat-related deaths than from any other weather-related events. We also know that heat impacts to health compound already existing health disparities and disproportionately affect the most vulnerable among us. So in that context, we are seeking to promote routine conversations between clinicians and patients before the heat season starts. So starting now, these are released, available, and we want to promote the use of these now. Our initial focus for implementation of these guidelines is in the nation's federally qualified health centers, a nationwide health system that I think you all are familiar with, that serves over 30 million people across the country, most of whom live below the federal poverty level. And it's a health system that both delivers care and provides referrals to interventions that address the social determinants of health, both of which are needed in order to protect people from the health harms from heat. And while everybody is at risk for health harms from heat, we're focusing initially on specific populations who are at increased risk for health harms from heat, and that is children with asthma, pregnant women, and adults with cardiovascular disease. And this guidance that I'm going to walk through shortly is meant to be paired with the HeatRisk tool that you just saw demoed by Holly and Rish, used by both clinicians and patients to prepare for the days ahead. Next slide, please. So this is just a bit of contextual information that shows the relationship between heat, air quality, and the 3 health outcomes of interest that we're focused on, that our guidance are focused on. This is illustrated as a linear relationship. It's not always quite this linear. Sometimes heat worsens air quality, which impacts the health outcome of interest. Sometimes heat directly impacts the health outcome of interest. Sometimes air quality directly impacts the outcome of interest. But heat and air are intimately related. Heat worsens air quality. And so you'll see our guidance includes recommendations to protect yourself from both heat and from poor air quality. Next slide, please. So these are the clinical guidance components that you'll land on if you press that button that both Holly and Rish showed you that said for healthcare professionals. You won't see a page that looks just like this, but you'll see this kind of content. And each of these are hyperlinked so you can look at these while we're talking or look at them afterwards. So when you land on the page that is for healthcare professionals, you will get to basic background on heat and health. How does heat impact health? Who is at risk? What are risk factors? The next tool that you'll see is a how-to tool for clinicians to learn and to teach their patients how to use the HeatRisk tool, which is brand new, so we expect people don't know, and a reminder on how to use the AQI. And I'm going to go through some details in a moment on that. The next resource is an important resource on heat and medications. So there is an important and we think maybe underappreciated relationship between heat and medication. So even on a cool day, some medications impair the body's ability to cool itself. You take that person on those medications and put them in a very hot setting, and that can become quite dangerous. So we this resource walks through how heat and medications interact. It walks through steps that we'd like providers to take with their patients to review their medications, prepare for the heat season, and potentially make modifications during hot months, and a table that actually outlines a series of example medications and how they interact with heat. And we'd really recommend you take a peek at this resource. Again, we think this is an under-recognized topic for people. And then we get to the 3 guidance documents on heat and asthma, heat and pregnancy, and heat and cardiovascular disease. These are available in a long form, although we've tried to keep these very concise, and also in a quick start. And there are both clinician guidance documents and then some patient tools, which I'll show you in a moment. And again, we envision these being used at the point of care in conversations between doctor and patient before and during heat season. Again, these are available now on our website for download, and in a few days, they'll be available on the website of the National Association for Community Health Centers for download. They're available in English now and should be available in Spanish in the next 10 days to 2 weeks, with other languages to follow. Next slide, please. So this slide is that you've seen this already in some of the slides you saw. This is a drill down of the document that I referred to, the how-to document for clinicians. And it's a comprehensive look at the page that you saw both on NOAA's website and on our dashboard. So this is excerpted from this clinician guidance document. And you can see, and you've heard about them, each of the color levels and the actions, the protective actions that people can take at the different color levels. So I'm just going to highlight a couple examples. Holly mentioned some of these. So on a green day, it might not be hot today, but you can get ready for warmer weather by learning about heat and your health. And then this hyperlinks you back to our general heat and health page. Versus on a red day where most people are impacted by heat. And when you go to the actual document and see all the information, you'll see that we've listed workers, athletes, unhoused individuals, those with prolonged exposure to heat or sun. We also know that in red or hotter heat risk levels, hospitals are likely to see surges in ED visits and other health outcomes. We also know that at heat risk red and higher, heat may lead to power outages, and this has impacts on electricity dependent medications or electricity dependent medical devices. So in red and higher, these are times that everybody has impacts from health. And so the guidance in red looks quite different than the guidance in green, where you've heard this again today. People should really consider rescheduling outdoor activities to indoor spaces. And if you have to be outside, your livelihood depends on working outside, find opportunities if you can to stay in the shade. So this information is available on the dashboard, tailored to the zip code that you plug in and tailored to the day that you plug it in and the 6 days hence. But this document available on the clinician site gives you a comprehensive look at the heat risk levels, the actions you can take, the heat risk by color, who's at risk, and how common that heat risk level is. Next page, please. So these are the 5 things we're asking clinicians to do in those conversations we'd love to see happening now. The first is assess patients' risk factors for heat and health, and I'm going to show you a little tool that we created for this in a moment. Second, educate people how to use the heat risk tool and how to protect themselves from heat. Educate people how to stay hydrated. Fourth, educate people how to use AQI to protect themselves from poor outdoor air quality. And if they're coming indoors because of poor outdoor air quality, how to keep their indoor air clean. And then again, just to reinforce having that conversation between clinician and patient on the medications they're on and whether changes may need to be made during the heat season. Next slide, please. So this is a mnemonic. This is a tool we created, a questionnaire for clinicians to help them assess risk factors from their patients on health harms from heat. And it's a mnemonic. It's a reminder tool, and it spells out chilled out. And I'm not going to read through all of it, but just I'll highlight a couple of the really high risk factors. So cooling, does your patient have working air conditioning? If they do not have access or can't afford air conditioning, do they have a fan? If they don't have either of those, do they know how to access a cooling center? Do they know what a cooling center is? Do they know who's responsible in their community for opening a cooling center? Are they housed or unhoused? Huge risk factor for health harms from heat. Are they isolated? Does their mobility inhibit them, or immobility inhibit them from seeking cooling areas? So again, I won't read through all of them, but we hope you remember that mnemonic, chilled out. And that's the first thing you want to do as a clinician with your patient, to screen for health harms from heat. Next slide, please. So here are some of the patient tools that we created. This is a tip sheet that mirrors the 5 tips that clinicians are learning about. And attached to the tip sheet on the right-hand side is actually our spaces to create a heat action plan. So we envision this a tool that the clinician and the patient fill out together, and that the patient carries around with them, same as a child may carry around their asthma action plan, maybe bring this to the workplace, bring it to camp. That really indicates the steps that an individual person will take to protect themselves from heat harms. And this is for all the 3 topics. Next slide, please. So in closing, how will we measure success? How will we know that These tools are working. So we have both process measures and outcome measures. We will be tracking on our website and on the website of the National Association for Community Health Centers downloads and use of these materials. We'd like to not have them something that sits on a web page, but something that actually gets used. And then importantly, critically, we want to make sure that the use of these tools actually impact people's health. So we will also be tracking reduction in ED visits over this coming year and to follow. And equally importantly, we want to make sure that people that are receiving these guidance documents also have access to community resources that they need. So for instance, through partnering with other federal agencies like ACF, we want to make sure that individuals know how to access things like heat resources, that they're not losing access to electricity when the heat comes. So I'm going to ask you to go to the next slide. I think this was my last slide, Anna. Yeah, so thank you very much. And let me turn it back to you.
Thank you, Dr. Seif. Before I move into the Q&A session, I just want to mention that there was a webinar on Monday about how HeatRisk works. And that webinar will be available in a couple of days, and we'll drop that link in at the end of this webinar today. Okay, so now I'd like to turn it over to Jonathan Lynch, the Deputy Associate Director for Communication in the Division of Environmental Health, Science and Practice, to start our Q&A session. Mr. Lynch, the floor is yours.
Thank you. Just a quick note, to ask a question, click on the Q&A button at the bottom of your screen. We have questions we gathered in advance and questions from the audience. We might not be able to answer everyone's questions. They might have already been answered or might be outside of the scope of this meeting. They might be very technical and thus we require a lot of time to answer properly. And also we might just run out of time. So the first question, how is heat risk new and different than heat advisories and similar?
Thanks, Jonathan. I'll let Ken or Kim have first stab at that one.
Yeah, I think the best way to think about it is this is yet another tool. So if you think about having a forecast office across the country having a tool to be able to use meteorological data plus data from the CDC, like emergency room data and data that actually really fortifies and verifies the fact that this type of condition could cause impacts to people, very negative impacts to people. So that combination will allow our offices to be able to issue those advisories and warnings, right, with even more confidence than ever. Right? They've always been. I've issued them myself based on the meteorological parameters. Now I got more confidence, right? I got real data, not just the science data, but the science data associated with those impacts to people. So it feeds our ability to be able to issue some of those advisories and the warnings. And it's going to be interesting. This is called experimental. And so we're going to get feedback from our offices to be able to really go forward and look how our program to support heat health changes over time and how we could really look at how we can keep everything simple as we go forward. So it's exciting. They all live together. They're really shaping how we do business in the future. So appreciate that question. Great question.
And I'll add a small addendum, and I agree with what Ken said, is I think what HeatRisk does, and I think Ken mentioned this, is it creates a uniform, clear understanding for people where they live about temperatures that create a health risk. So the other tools in the toolbox are based on various meteorological factors that are important. The heat risk forecast is directly reflective of what those specific meteorological conditions mean for health in that community. And so even if you're, anyone in any of the contiguous 48 states now can look at this forecast and you can look at the gradations in heat risk and recognize, boy, I'm someone who, I've been outside on lots of orange days, never have a problem, no big deal. But on red days, I really run into trouble. Or I might be someone because of, any number of issues where I have to be taking some steps if I'm going to be outside to stay healthy on an orange day. And so I think it's transformative because it enables actions based on health. And it also, heat risks or heat alerts that are given by the National Weather Service are given based upon the entire population, right? So those standards are uniform. And so you don't want to be giving a heat warning for everybody when temperatures aren't really high, because in these summers you'll be doing a lot. What HeatRisk enables is it enables individuals to say, maybe I'm someone who's more sensitive and I need to pay attention to temperatures that may be well below what might trigger a heat warning, a heat alert from the National Weather Service. And I think that's very important from a public health standpoint, because the people who get sickest, quickest, are generally getting sick at temperatures well below when a heat warning may be issued, because that heat warning is going to be for everybody. So I think there are some really important public health implications for heat risk.
Thank you. That is very exciting. The next question: do you have guidance or examples of how health departments have used this or previous heat risk indices to give guidance to the general public? So, in effect, residents of a city or county.
Glad to let Ken have a first crack at that one too, if you'd like.
Yeah, absolutely. Appreciate another great question. These questions are incredible. This one here, our weather forecast offices, one really amazing thing about the Weather Service is our offices are right there on the front lines in these communities, in the communities with the vulnerable population. So I've got examples of where we could look at heat risk or look at that heat advisory. We put that in the morning hours. There's conference calls with emergency managers, and many of the emergency managers at some hospitals and otherwise are on those calls. So they're getting information about, the dangers of heat, or maybe, remember, it's not just for the next day or today. It could be 3-4 days ahead of time. In this case, 7 days ahead of time. You can picture getting information 6-7 days out about upcoming heat, and that allows, the health community, a hospital, clinics to be able to say, wow, we need to get ready for this upcoming event. Hopefully these tools will reduce the numbers of people that will need the emergency rooms, but the reality is that they can prepare. So when I was in Louisiana, we would give the briefings to talk about heat, and that the health community would answer and ask questions, and we saw them directly look at how they can adapt their operations. And also emergency managers. The other part that I have to add to this is often we see emergency managers open cooling shelters. So they'll open up cooling shelters based on this data, and we'd rather have people in a cooling shelter than the emergency room. So we do have examples of people using the information, and it really does work. This new tool makes it easier than ever to understand the information, and hopefully it makes the decisions even easier to make.
Thank you. Okay, going to the third question. It's hard to create an index that captures local variation and CONUS-wide central tendencies. Is it possible to get a data set of past heat risk values daily so I can chart the relationship between ED visits and deaths to heat risk scores in general and over time?
So I think we can put a link in the chat for the data, but I think the question reflects to me a need for a clarification about what heat risk is. That relationship between health outcomes and temperature is what is the foundation of the heat risk level. So you don't need to go back and compute that, because that's what heat risk is. Now, if there are specific health outcomes data that you have access to that you want to look at, sure, but I just want to be clear that that's the whole reason that heat risk exists, is because the health outcomes data are baked into the forecast. These are locally based heat health relationships. And the link, thanks Akeshi, is in the chat.
Just Jonathan, just to add real quick, so you have the locally based health information, but remember we look at heat index. We look at the values even meteorologically. We don't treat Miami the same as Chicago, or we don't treat Miami or Phoenix the same as Minneapolis or Seattle. So we got the locally derived health information, but we're also looking at the meteorological data is also taken into account locally when it comes to what we're doing from the meteorological standpoint as well. So both of those combine into the heat index, and that's why this is so special. That is about the local area. That's what makes this such a historic amazing product from CDC and us at the Weather Services. It's all about local, and that's why it's a heat risk overall for that local area.
Thank you. Okay, next question. Do CDC or National Weather Service have data at the county level to define extreme heat day relative to that county? For example, like the 90th percentile or something similar.
So I think this question also makes me want to make sure we've spoken this point clearly. So the 90th percentile of temperature is different in different places, right? So 90th percentile in Augusta is not the same as 90th percentile in Houston or anywhere else. And what we know from the health data is that hitting the 90th percentile of temperature does not mean the same thing for health everywhere. So that's why heat risk is so important, because it takes the guesswork out of what temperatures and what meteorological conditions are more risky for heat in that jurisdiction. So I would caution against saying, 75 degrees, if the 90th percentile is 90 degrees, like I would caution against using that, because it's not just that. The heat risk, as our NWS colleagues have mentioned, incorporates a lot of other important data that is a part of what meteorological conditions and climate conditions can do for health. And I'd like us to move away from saying it's this temperature, it's this percentile, to a more holistic understanding of weather conditions and health outcomes integrated, because that's going to make us better able to protect health. Ken, I don't know if you want to add to that.
I think you nailed it there, and I think just everybody has to be really clear that what the value of this information with the heat risk tool is all about local. And some other examples, I have a chat set up here with Kim McMahon. She's kind of the brainchild of all this, so Kim, jump on anytime. But she just chatted me some great examples. Maricopa County has a planning team that uses heat risk to hand out water. So they look at heat risk and say, you know what, we better get the water ready and let's start handing out water based on this. FBOs, organize FBOs to reach out to communities most at risk whenever the tool indicates that. Schools in Sacramento use the heat risk to determine outdoor and recess activities. Both of my daughters have played softball since they were really little girls. And the fact that there were days, as a meteorologist, I'm like, I don't know if we really should be out here, honestly. So you're looking at communities use this to be able to make those type of decisions. So Kim's on here as well. She's my phone a friend, by the way, for this wonderful conference call. But she might have more information on that. But there's all sorts of examples. So please, everybody listening, this is truly taking the meteorology, the health statistics from hospitals, combining those together to make a hyper-local look at the overall heat index. And that part makes this such a valuable tool.
Yeah, Ken, Ari, you stated extremely well. I will just add that what heat risk does is it takes the forecasted maximum minimum temperature, marries that into a context of how above normal is the heat, how long is it lasting, and connects that with the heat health information for a given location over the course of 7 days. So it really does provide that outlook of, do I need to be paying attention, out on day 5, 6, 7 of the forecast? And how does that impact me? What we're used to taking into account that as the summer months, as we go into the summer months, people do acclimate typically to the heat. And therefore, that is also taken into account when we're talking about how unusual the heat is compared to climatology.
Okay, thank you. The next question, is the day of the week taken into consideration? For example, does it assume there's less risk on the weekend when there are potentially fewer outdoor workers?
I would ask Rish or maybe Ken or Kim to answer that one.
Kim, back me up if I get it wrong, but the day of the week is often, you got the workers during the week, but then I can tell you the number of outdoor activities on a weekend, from sports to soccer to softball to football, et cetera. There's an amazing number of people also out on a weekend. So that threat I mean, could in theory be influenced by some of the health data, but at the same time, that threat's there no matter the day of the week.
Yes, Ken, I absolutely agree with that statement, and I would just pass it to Rish, who did the epidemiological study, for more detail.
Yeah, sure. I think thanks, Ken. So yeah, we do factor in day of the week in the health modeling. In addition to day of the week, we do take into account seasonality, long-term trends in mortality to model the relationship between heat exposure and mortality. So yeah, all those factors are taken into consideration when we do the epi modeling.
Okay, thank you. The next question, can you provide more details on the epidemiological data used to tailor the messaging to specific zip codes? In effect, were thresholds of risk determined using local epi data representing direct measures of impact, such as mortality or morbidity?
Rish, please.
Yeah, sure. Thanks. Yes, I think for this, for setting thresholds using health data, we use heat mortality relationships derived at the county level. And if you could go to slide 20, I have an example there of one more, or okay. Basically, we have these relationships where we start with again, like the webinar, that the link to the webinar that Kim submitted in the chat will give you that the process of like how we use health data, how we sort of integrate it with temperature-based information. So, but we do factor in heat mortality relationship at the county level. So that sort of informs the yellow, the orange, and the red category.
So next question, are clinicians given guidance on when fans are and are not effective to cool down from heat? They're saying it's important for patients to be aware fans can actually make it worse past a certain threshold.
Laura?
Sorry, I'm on mute. Yes, fans are helpful in reducing temperature until a temperature of 90 degrees. And after 90 degrees, the fan can body temperature. So at that point, that's 90 degrees inside. So at that point, we'd recommend people use other means to cool themselves.
And just one follow-up point. Some of you may Google research in this area, and there are a few studies suggesting that fans may be protective at higher temperatures, particularly when it's humid. But we're mindful that we are giving guidance for populations that may not be reflected in those studies, who may be more sensitive to heat. And so we took a conservative measure, but it's certainly true that fans can increase, as Laura mentioned, body heat, and that is absolutely in the guidance.
Okay, thank you. One person is asking about attempting to download this on the App Store. And can you clarify whether it's just an app or it's a website?
So right now there are the two websites that we've mentioned, the NOAA portal and the CDC portal. I think one of the main differences is the CDC portal includes the heat risk stuff that's on the National Weather Service. It also includes the guidance pieces that we haven't attached to heat risk. We are in active conversations with the folks who develop apps for phones. And just remember, folks, that this went live nationally 2 days ago, so we need to give them some time to get it up to speed. But it would not surprise me to see heat risk appearing in your weather app, and we are very aware that that's where most people are looking these days. Many people are looking for weather forecasts.
Thank you, and I look forward to that. Next question is for National Weather Service. They're asking, will NWS reference heat risk in their local forecasts? How will heat risk integrate with the existing process for heat warnings?
Yeah, I think the big thing there is, using the tool to be able to influence what we do with the heat advisories and heat warnings. So you'll see a reference. I would imagine if I was on a desk, right in the forecast discussion, I would definitely be able to reference the website or reference the information and be able to use that as a tool to be able to, issue those warnings. But I think the biggest thing is just, highlight it in our products to be able to really point people to the right place. I can see we have something called impact-based decision support, where we're giving the briefings to emergency managers where the health community is on there. Without a doubt, you're going to see those graphics appear on those briefings. You see the graphics, you see the tool, you see the website to really point the decision makers to that information, including the information from the CDC. So Kim, I don't know if you wanted to add anything to that, but the answer is yes, you're going to see that reference.
Yeah, and I will say that while the for the Eastern United States, HeatRisk is something new. It has been utilized in the Western United States for almost a decade. Our offices have been noting it on their social media posts on Facebook, Twitter/X, and Instagram. And they also, in the Western region, within our warnings, won't specifically state heat risk, but they will state if in what we call an impact statement, if it's a moderate risk or a major risk or an extreme risk. And that was utilized a lot within the 2021 Pacific Northwest heat dome. So word is getting around, and we are referencing heat risk in different ways. But of course, we want to make sure that the information that we're stating is very plain language and clear, and includes actions for people to take to keep themselves and their loved ones safe.
Okay, thank you. And we have time for one more question. They are asking, how well can people know when the data is reliable at a certain level versus a higher level? Summarizing a little bit.
I'm not sure I understand that question as articulated. We do have,
I am translating.
I would say that and I'll let Rich chime in here too. As Kim and Ken have mentioned, this tool has been prototyped and beta tested in the Western region for a good long while, and we've been able to look. And see that the heat risk levels do a remarkably good job at predicting health outcomes given current data, right? So we've looked and said, okay, if the heat risk level is yellow versus orange versus red, do we see an incremental increase in ED or use of the emergency department, other health outcomes, and remarkably well. It's not perfect, no model's perfect, but it is really quite impressively good at predicting those incremental changes in health outcome based upon the heat risk level. Rich, I don't know if you want to add there.
Yeah, just nothing more to add. Just wanted to reiterate. Yeah, we've used independent data sets to validate heat risk, and then using a similar like a health impact assessment framework, and it is performing really well. And also I should add, we would be working with our public health partners, especially partners who can share like the national syndromic surveillance data. And so we're using that information for the 2024 heat season to sort of compare and evaluate how well heat risk performs. And then I should also add that the tool, as Director Graham mentioned, it's experimental. We're collecting feedback. So any performance issues or anything we could, iron out, this summer will inform us to see what other information we can add. So definitely, so far it's looking good, but we will, keep an eye out for any corner cases this summer.
And to give some confidence is, the Weather Service, we have 1 kilometer grids that we're really looking at the forecast. So it's going to pick up on urban heat island. It's going to pick up on some of those subtleties, including elevation. So as long as the forecast for the humidity, the forecast for, we account for wind and everything. Anyway, all the things that meteorologically that we put into the forecast, if that's accurate, combining that with the CDC data, which is historical data, you could really have some good confidence that this is a good tool to be able to use. So as everyone else said as well, we'll be learning as we go forward and adjust along the way.
And I would
Thank
just
you.
like to add to Director Graham's comments that heat risk is based, or the heat risk forecast is based on our maximum temperature forecast and our minimum temperature forecast, which have shown incredible performance. I do also want to note that heat risk is available now, and we keep saying it's experimental, but that really means that we are intending to have this comment period and evaluation period so we can potentially make improvements before taking it operational.
Okay, thank you. And that does answer the question. It was somewhat awkwardly worded, but I think that answers it quite well. And so that's it for the Q&A. Thank you, everyone. And I'll hand things back to Commander Khan.
Thank you. Thank you so much. Well, before we go into those last steps, I just want to reiterate what Kim and others have said, that the tools and resources are available now to be used, and that NOAA's heat risk forecast feeds into the heat risk dashboard on CDC's site. And we encourage you to provide feedback on the heat risk forecast tool. And that concludes today's EHNexus webinar. Thank you for joining us today, and a special thanks to our presenters for sharing their time, insights, and expertise. Take care and have a great day.